For Group 2's presentation, we chose to research how poverty affects the health of an individual. Group members include Kylie Hayes, Christina Joshua, Corey Lance, Stephanie Powell, and Olivia Ray. So what is poverty exactly? According to Merriam-Webster's online dictionary, poverty is the state of one who lacks a usual or socially acceptable amount of money or material possessions. Another definition from dictionary.com says that poverty is the state of being inferior in quality or insufficient in amount. I'm not sure about you, but being from a small rural community, I can think of several individuals that would fall into this description. Oftentimes, when we think of poverty, our minds venture first to a financial aspect. We think of individuals who live in poor neighborhoods, in rundown housing, and maybe even ones who have no home at all. What we fail to realize, though, is that poverty can be directly related to an individual's overall health. In the same way, poor health can result in poverty. It's a vicious cycle that is deeply rooted in political, social, and economic injustices. Because of poverty, individuals are forced to make tough health-related decisions every day of their lives. Do I have enough money to refill my prescriptions this month? If I do, will I be able to afford the light bill? I know that I have diabetes and heart disease, but healthy food choices cost too much. A double cheeseburger from the dollar menu is much cheaper. Children who grow up in poverty are not likely to have their nutritional needs met. This causes healthcare gaps to form that are hard to close as the child ages. Dental and vision disparities occur due to the lack of healthcare. Nutritional deficits, along with the toxic stress environment, can cause children in poverty to develop lower IQs. One study that we found interesting was a 2017 study by the Urban Institute. It stated that only 62% of children who spent at least half of their life in poverty obtained a high school diploma. We all know that education is key in all things healthcare related. We must be able to understand the facts related to our health, even in layman's terms, to be able to be compliant with our treatment. Poverty has proven to be problematic in this instance. Children in poverty are also more likely to obtain injuries. This is because most homes are without functional smoke detectors, have unprotected windows, and unsafe stairs. The three public health functions, as noted earlier in the semester, are assessment, policy development, and assurance. Each function has public health services associated with it. Statistics are known for trends in the health status of those in poverty or in underprivileged communities. Provided here are just a few examples of the statistics that are being tracked. We can see here that life expectancy varies depending on an individual's wealth. In a study done using filed tax records and mortality data from the Social Security Administration death records, the gap in life expectancy between the wealthiest 1% of the United States population and the poorest 1% was 14.6 years for males and 10.1 years for females. Considering the time that we are in, this is unacceptable. Studies using the Appalachian Mountain region of the United States, which traditionally consist of low-income communities, have shown up to 13% higher infant mortality compared to those in other regions of the United States. Again, this is unacceptable. Those living in poverty also have an increased risk of comorbidities like heart disease and diabetes. In addition to these disparities, those in poverty tend to suffer an increased number of days absent from school and/or work due to limited access to care and/or because of the cost of treatment. In regards to policy development, we found several organizations that are attempting to bridge the gap between poverty and health. The World Health Organization spends most of its focus targeting interventions in third world underprivileged countries. This includes providing support to medical teams for travel to specific regions to supply medications, give immunizations, and to provide other needed resources to team members. Examples of these services include addressing malnutrition, providing polio vaccines, and establishing refugee camps. The Child Poverty Education Subcommittee of the Academic Pediatric Association Task Force on Child Poverty has created education for medical and public health students across the United States and Canada. This education focuses on 4 domains: epidemiology of child poverty, poverty-related social determinants of health, the pathophysiology of the health effects of poverty, and the leadership and action needed to reduce these health effects. This is a standardized approach to help increase competency for those in training that will encounter these issues on an unfortunate but regular basis. Poverty eradication is targeted towards those that live on less than $2 per day. But there are numerous others that live in poverty, although not as extreme, but still needing targeted efforts. This calls for a re-examination and possible expansion of this eradication effort. To help care for those suffering, you must know how to recognize the causes of suffering and the barriers for achieving that goal. Listed here are some ideas, including those we've already discussed and will discuss on subsequent slides, to target efforts that address the health of those who are underprivileged. As you can see on the slide, we desperately need more community clinics like that of the 12th Street Clinic in Little Rock. Free clinics that provide care based on the donation of medications and volunteer time are essential to those in poverty. Some of these efforts are currently underway, but greater outreach and advocacy for those in poverty is needed. Listed here are just a few of the current issues that could potentially impact the resolution of poverty as it relates to health. These include adequate and affordable housing, cultural beliefs, health disparities, and politics. We will discuss recommendations to address these issues on the coming slides. The main focus point is that these issues are real and they do not seem to be going anywhere anytime soon. Our recommendations for addressing the health outcomes due to poverty are fourfold. First, we must identify the at-risk population. Second, we will assess the healthcare needs of those in poverty. Third, we will develop policy to improve their healthcare outcomes. Lastly, it's important to expand community health. There is no one definition of poverty. Depending on where you look, you may find information on the federal poverty level or the level at which citizens qualify for Medicaid assistance. Regardless, assessing income, family size, and financial obligations are important in identifying those at greatest risk for poor health outcomes secondary to poverty. It is important that we consider children, disabled persons, pregnant women, and elderly, as these can be marginalized groups. If you look here at the slide, you will see examples of each specific population, whether marginalized, including children, disabled, pregnant women, and elderly, or the non-marginalized populations, like those individuals who have limited access to healthy fruits and vegetables, or those with limited child care options. Regardless of the group, all needs should be assessed in order to adequately address policy options to improve health. Currently, there are several governmental developed policy guidelines and goals for improving the social determinants of healthcare and healthcare outcomes for those in poverty. Two such examples include Healthy People 2020 and Health in All policies. Though structured somewhat differently, both of these government-based public health projects aim to develop policy that will eventually improve the health of communities as a whole. Health in All policies, in particular, aims to incorporate health policy into all decision-making for all policy using key elements. Lastly, expanding community health is essential for addressing poor health outcomes due to poverty. According to What Works for America's Communities, health, poverty, and community are inseparable. Monetary aspects that cause poor health in poverty-stricken individuals is just one aspect. The community in which the person lives and grows impacts health just as significantly. Therefore, it is our recommendation that when addressing poor health and poverty, we address not only the health and the poverty, but the community as well. The next two slides show the references that we used for this presentation.